My name is Chris Cooper. This is a presentation of community health assessment on Hernando, Mississippi. Hernando was settled initially in 1832, known as Jefferson, until its incorporation in 1836, that it was known as Hernando, after Spanish explorer Hernando de Soto, who was one of the first Spanish explorers to pass through the area in around 1841 on a quest for gold. Additionally, Hernando was originally home to both the Choctaw and Chickasaw tribes of the northwestern region of Mississippi. This is a picture of the health department. It's worth noting that it's in a complex of buildings that are all county or city dedicated entities like DeSoto County Economic Assistance, the Agricultural Department, the 4-H. They kind of share a parking lot, a number of buildings there. It's not a small operation. These photos were taken on a Sunday, so you can't see some of the traffic there, but I imagine it gets pretty busy. This is the Baptist Memorial South Haven Hospital. It's a full-scale hospital, ER, ICU, cath lab, floors, all that. It's not in Hernando. It is 11 miles up Interstate 55. But very Hernando adjacent and available to the population of Hernando. These pictures are of the town square. Again, emphasis on these pictures being taken on Sunday really doesn't do justice to how much activity goes on here during the week. There's restaurants, there's farmers markets, community events, really a lot of opportunity for community engagement around this square here. This is the county seat animal hospital run by Dr. Pat Berg. It's been there for 30 years. I did have a chance to talk very briefly with Dr. Pat Berg while I was there. We'll talk about that a little later on. This is the Nesbitt Blueberry Plantation, also Hernando adjacent. It is my family's blueberry farm there, but I do think it highlights some of the rural aspects of Hernando that make it really attractive just to people that, maybe don't want to be too close to the city or in the city but still have access to it. And we'll talk about how Hernando's location caters to that kind of person looking for that characteristic. But really nice place. Love to be there. This is the DeSoto County Administrative Building. This kind of illustrates that Hernando not only is its own city, but there's a county-wide investment in Hernando as well, and a presence there. Hernando's kind of a hub for DeSoto County, too. This is DeSoto County Economic Assistance. This is in that complex of buildings with the health department, and just kind of further illustrates that it's more of a almost sprawling complex than it is a standalone small health department. Here's the first regional library right off the town square. It is large, and it's a really great resource for the community there to use. Again, another important landmark, City Hall, also just off town square, but important aspect of Hernando there too. Hernando has a diverse profile of economic, social, and physical characteristics that all contribute to its unique bill of health. The city maintains almost 150 miles of streets, upholds high standards of public water and sewage, and oversees waste management. The city straddles two major roadways, Interstate 55 and Highway 51, providing easy access to federal and state-maintained major roadways to efficiently get to neighboring cities such as South Haven, Mississippi, which is where the Baptist Hospital is, or Memphis, Tennessee, just 25 miles up the interstate. Additionally, Hernando is home to the Hernando Village Air Park, which is a small, privately owned but publicly used airport 2 miles from the Central Business District. The Office of Community Development is really essential for their social environment there. They write and manage private, state, and federal grants and secure funding for community programs. Some of these programs include, but certainly aren't limited to, healthy food access, health and safety, recreation, youth leadership development, and workforce development. Additionally, through the Office of Community Development, they've established a very robust farmers market, and a lot of community outreach programs operate hand in hand with that farmers market. Some examples of those programs: Double Up Food Bucks is a program where every dollar a person spends on fruits and vegetables using SNAP benefits, they'll receive an additional dollar to put towards additional produce, essentially doubling their money up to $20. Also, the Water Tower 10K and half marathon is also promoted at functions like the farmers market. So really, really pivotal program there. Hernando's economy is responsible for roughly the employ of 8,000 people. The largest sectors of employment include healthcare, social assistance, manufacturing, and education. Average income is $71,451, which is strong. Roughly 9.3% of the population lives in poverty. 89.2% of the population has some form of health insurance. As we mentioned earlier, their Office of Community Development does a great job there of maintaining a social system in the community. Hospital access, 10 to 15 minutes on Interstate 55, 11 miles to get to the closest full-scale hospital. But Memphis, Tennessee, also home to some level one trauma centers and large regional hospitals, St. Jude, things like that. So, additionally, Hernando High School is ranked number 3 in the state, so strong selling point there. Hernando's strengths: they're located in a very attractive area. They're close to urban amenities, but with access to rural aspects of living as well. The convenience of getting on 55 and going to South Haven or Memphis is great, but it also insulates the town a little bit from some of the spillover of things that are less attractive about living in bigger cities or real big cities like Memphis. The number 3 high school in the state is a huge strength. It shows investment in youth and education, and how Hernando can be a really strong starting point for kids or to start a family where kids will be in school there. Access to the full-scale hospitals via major roadways is always good. There's a strong median income with a very considerable workforce as well. So some weaknesses: 9.3% poverty rate for a population under 20,000 is not considerably high when compared to like the national average, but certainly some community level investigation could be done here to look at what modifiable factors might contribute to the number in a town like Hernando, and maybe get that poverty rate down some. And kind of two, Hernando has a considerable workforce. A good portion of the workforce is in healthcare. They have access to full-scale healthcare systems. The uninsured population should certainly be investigated, and we'll talk about that a little later on as well. Obesity plagues the southeast region of the United States, Mississippi, and DeSoto County is no exception there. I couldn't get obesity information directly on Hernando, but the DeSoto County obesity rate is 41%. And in my brief conversation with Dr. Patberg, while he did put a lot of emphasis on his area of expertise not being people but pets, he did note that he does see obesity being a prevalent problem in the community. This information mostly came from secondary data collection through census-generated numerics. But additionally, the City of Hernando's website, a primary source detailing the city infrastructure and components, and the Advisory Council on Historic Preservation for a little history on Hernando. But the County Health Rankings, Data USA, both secondary sources with a lot of input from the census. And then the U.S. News and World Report puts out a school ranking list, which is where Hernando High School is ranked number 3 in the state. I did have a brief interview with Dr. Patberg. Just noticed he was at his place of business. Know that they have a great reputation, so I just wanted to get permission to photograph it. And we talked briefly about one thing, anesthesia, but also community health, the purpose of the project, and kind of his take on the population of Hernando and things that he notices. So community health plan of action, kind of twofold here, but for part one, the area emphasis would be uninsured population of 10.8%. To me, it sticks out as something that needs to be investigated, given, as I said earlier, the portion of the workforce in healthcare and the access to healthcare. So part one of the plan of action addressing the uninsured population would be first to identify barriers to health insurance enrollment over 6 months, distribute surveys at public events, the town square, the farmers market, runs like the Water Tower 10K, conduct interviews and focus groups with clinical staff and social workers. I really want to tap into some of the healthcare workforce and get their opinion on it. To kind of measure and evaluate part one of this intervention, count the surveys completed that are passed out at community events, and then also compile key takeaways from focus groups. So that's kind of the 6-month phase. The part two here is education and awareness, which would use what we learned from our survey and focus groups and distribute information about insurance and resources to the community. This would last a year, and we would evaluate the effectiveness via pre and post awareness interviews. So that's how we can target the uninsured population. I also think it's worth noting, especially in conjunction with Dr. Patberg, that an obese population of 41% is absolutely an area of community health that we should be targeting at community levels and communities across the country. But a plan of action here, part one would be to map and access and interview people about healthy diets. So kind of two parts there. The map access would be looking at Hernando and seeing what regions of the city have quick and easy access to healthy foods. A lot of what can drive a poor diet is convenience. So interviewing the population to determine what do they know? Is it an educational gap that's driving an unhealthy diet too? So those two things together, lasting about 6 months to kind of get some base information to then proceed with part two, education and exercise. So using the mapped information, we could identify areas of need, and then using those identified areas, establish exercise groups or distribute dietary information. I'm going to do that for a year and evaluate via satisfaction interviews. The impact of the community health assessment here is twofold. One is to highlight the good things about Hernando. Hernando's for a long time been very high ranking in the county health rankings in terms of health. It certainly deserves recognition for that. We do want to steer conversation with Hernando towards a focus on the areas of improvement. We don't want to just dwell on the good. There's always areas where we can make real measurable change, and the uninsured population and obesity are good places to start. The stakeholders here are community members and the community and government leaders in Hernando. Here's a list of my references, and I will also be submitting some documents too for review.